Good day, I am ACE student leaders of NR33 and now I'm going to demonstrate on how to perform the establishing and maintaining sterile field. First, assemble all necessary equipment. Sterile package with a sterile drape. Pair of sterile forceps. Sterile supplies or equipment, sterile gauze. Sterile supplies or equipment, sterile bowl. Perform hand washings or hand hygiene using alcohol and dry hands freely. Ensure that the package is clean and dry. If the contents or inside portion of the package is moist or wet, it is considered contaminated and must be discarded. Check the sterilization expiration dates on the package. Spot stain which may indicate contaminations. Opening a wrap package on a surface. Stand 1 foot away from the table to prepare in establishing the sterile field or when depositing sterile supplies to sterile field. Place the package in the center of the work area so that the top flap on the wrapper opens away from you. Reaching around the package, push the first flap on the outside of the wrapper between the thumb and index fingers. Pull the flap open, laying it on the far surface away from you. Repeat for the inside flaps, opening the top one first. Use the right hand for the right flap. And the left hand for the left flap. Pull the fourth flap toward you by grasping the corner that is turned down. Lay the last flap on the rear surface, making sure it does not touch your uniforms. Adding commercially wrapped supplies to a sterile field. Locate the partially sealed edge or opening and hold with both hands such that the pulling hand is holding the lower flap of the opening edge. Hold the package 15 cm 6 inches above the sterile field. Allow the content to drop uninterrupted on the sterile field. Note, keep in mind that 2.5 cm 1 inch around the field is considered contaminated. Depositing sterile object from a sterile container. Remove the lid and hold it above your waist with the innermost side facing downward. Hold the lid still and do not move it around. If it is necessary to put the lid down, invert it first so that the innermost side is facing upward. When depositing a sterile object from a sterile container, do it within the shortest possible time. Do not talk, cough, or sneeze while the container is open. Using sterile forceps to handle sterile supplies ungloved. Get the sterile forceps from the container. Make sure that it does not touch unsterile objects. Hold the sterile forceps above waist or top level, whichever is higher. Hold sterile forceps with sight. Use forceps to transfer sterile supplies within the sterile field while avoiding the sterile field, the edge of the field, and the outside wrapper. While moving sterile objects from container or within the sterile field, make sure that the ungloved hand which touches the handles are kept outside the sterile area. Once the sterile supplies have been removed from the container, do not return them inside the container.